Thank you very much and good afternoon. And I want to start by recognizing that this is the day that starts the end of Ramadan. It's the day about love and peace. And I wish all of my friends and colleagues who celebrate this who celebrate this day an Eid Mubarak. And I know this is the most challenging time both here in BC and around the world, and let's hope we can leave behind these challenging times for next year's celebrations. So today we have 587 new cases of COVID-19 to announce here in British Columbia, including one epidemiologically linked case, to bring our total numbers of people diagnosed with COVID-19 to 137,810. That includes 126 people in the Vancouver Coastal Health Region, 365 in the Fraser Health Region, 21 people who are in the Vancouver Island Health Region, 60 people in the Interior Health Region, and 15 people in Northern Health. We currently have 5,691 active cases across the province, of whom 413 people are in hospital, 141 remain in critical care or ICU. And 130,310 people have recovered from the acute phase of COVID-19. As some people may have noticed, we are no longer reporting on the number of people under active public health monitoring or follow-up, and this is for very practical reasons. This was a metric. It was basically to give people a sense of how many people have been required to be isolated or in quarantine because they've been exposed to somebody with COVID-19. And we initially started this last summer when we had our surge of cases in the interior around Kelowna as a way of helping people understand the impact that it was having, not just on people who were diagnosed with COVID-19, but on their contacts as well. With this information, however, is based on public health follow-up with every single contact, and that continues. We do case management and contact tracing across the province, and all contacts are followed up on an individual level, but pulling that data together to be able to report on an aggregate level has become more and more challenging. We don't have an IT system that does that automatically, so my colleagues in the health authorities tell me it is very time-consuming and difficult to verify. So rather than provide information that is no longer accurate, particularly as cases had increased over the last little while, and it is something that doesn't affect our day-to-day work in public health. So we've made the decision to stop posting that information because it no longer was accurate enough for that. We have no new outbreaks to report today, which leaves us with 3 outbreaks active outbreaks in long-term care assisted living or independent living, and 2 in acute care. We have 5 additional deaths in the province today, bringing the total number of people who've died from COVID-19 to 1,632. Most of the people affected, again, were over the age of 70, several in their 80s and 90s, and one was a person in their 60s. And our condolences go to all of the families who are mourning the loss of their loved ones, their community, and their care providers. We know how challenging it is in this time. I also want to report today that we have had a second case of vaccine-induced immune thrombotic thrombocytopenia, or as we call it now, VIT, following receipt of the AstraZeneca vaccine here in British Columbia. This person is a male in their 40s who is in stable condition now, receiving care and treatment in the Fraser Health Region. As we know, this is a rare but very serious condition, and we are following it carefully. Recognizing the symptoms and getting treatment early is important. This is a condition that's we're learning more and more about since the safety signal was first detected. And what we do know, it is caused by For some reason, in some people, the vaccine seems to stimulate an immune response that develops antibodies against our platelets. So this causes a type of clotting that is different from other types of blood clots that people may have had, or strokes or other types of clotting disorders that people may have. So it is a very challenging one to treat, but there is a test for it and there is treatment. So people, if anybody after any vaccine in the last 4 to 28 days and is feeling unwell, you should call 811 or connect with your healthcare provider, particularly if you have serious symptoms which include persistent severe headache, shortness of breath, ongoing chest pain or abdominal pain, swelling or redness in a limb. Those are things that should cause you to seek treatment right away, and there is a test that can be done that helps us indicate whether this is the cause of those types of symptoms, those types of clotting symptoms, and that's a basic test of platelets. That is one of the first ones that needs to be done. We are following this carefully, and as we know, it is rare, but it is also serious. And we need to look at it in the context as well of the serious illness that we continue to see, particularly in people in their 40s, 50s, and 60s with COVID-19. On that note, so far in British Columbia, we have delivered 2,335,513 doses of all 3 of the COVID-19 vaccines here in BC. Of these, 119,691 have been second doses. So this means that over half, 50% of those who are eligible, so adults over the age of 18 here in BC, have now received their first dose of vaccine. Our immunization program is moving quickly as more and more vaccines are available, and the ages for those are eligible are coming down. We anticipate that all adults will be eligible very soon. We are also actively working to incorporate the age 12 to 17 into our immunization program, and we will be sharing more information about that early next week. And I know how important this is, particularly to that group of teenagers in the 16, 17, 18 who are finishing high school this year, and we look forward to this being another thing that will be important to ensure we can have some safe celebrations of graduation coming up in June. And so stay tuned as well. We will have more information about how we can support graduations for young people this year, knowing how important that is. I will say yesterday as well, we communicated that we have made that decision to reserve all of our remaining AstraZeneca vaccine for second dose boosters for those who want it. This is not about vaccine safety. That is, of course, an important consideration, but really it's about the operational response and the position we are in BC right now, and also in the context of the global supply. Operationally, we now have an abundance of Pfizer and Moderna vaccines and are expecting more to come in the coming months. So that time to wait, as we had before, has been reduced, and soon all adults will be eligible for vaccines through that program. The AstraZeneca vaccine has been an important and key part of our program, particularly when we had paucity of vaccines over the last few months. And I do want to say that it is important for people that received AstraZeneca. You did make the right choice, both to protect yourself at a time where the risk of COVID has been very high and continues to be high, but also in receiving that vaccine, and any vaccine, you also protect others and make sure that we can get more people protected quickly in our system. Operationally, though, it means that other nations around the world also have challenges in getting vaccine, and we're seeing what's happening in countries like India. So it is incumbent on us in Canada to make sure that we're not taking more than we need. And with the supply that we have in place coming for Moderna and Pfizer, we don't need to have additional supplies of AstraZeneca at this point. We will continue to ensure we have sufficient supply for dose 2 for everybody who's received dose 1 with AstraZeneca, and we'll continue to follow the data on the studies around the world that determine, that will help us understand which is the best option for people for dose 2 if they received AstraZeneca first. And in that way, we'll let you know. It's my expectation that people who have received AstraZeneca so far will have a choice once we know more about taking Pfizer or Moderna as a second dose. So now I'd like to spend a little bit of time going through some of the data that we have around how well a vaccine is protecting people in British Columbia. I've had many, many questions about people who have received at least one dose and whether they've become ill afterwards and what that means and who's been affected. So I have a few illustrative slides here to help summarize what we've seen here in British Columbia. So what we call a breakthrough case is somebody who has received at least one dose of vaccine, and initially we look at a period of time, 7 days, 14 days, 21 days. It takes some time for your body's immune system to respond to the vaccine and develop those protective levels of both antibodies and the cells in your body that help protect you long term. So what we have seen since December 27th, when first doses were initiated, until the 1st of May, is that we've had about 79,480 cases of COVID-19, and the vast majority of them have been in unvaccinated people or people who have not yet mounted that full immune response. Those who have been vaccinated and at least 3 weeks after their dose 1, we've had 1,340 people who have been affected. That's about 1.7% of the cases. And there's about 120 people who have had 2 doses and have been infected with COVID-19. Of the 1,340, 141 people were hospitalized. 13 people ended up in ICU, needing ICU care, and we have had 30 deaths. Like what we see with our cases overall, the average age of cases reflects what happens in the community, so where we've been seeing transmission, and the median age is about age 49. The age of people hospitalized goes up, as we know it does for across the board. And the average age of people who've been immunized, who've required hospitalization, is 81. The average age of those in ICU is 71, and the average age of those who've died, sadly, is 87. So that reflects again that the main risk continues to be age in having severe disease and hospitalization. This is a graphic that shows you where we see most of the cases after people have been immunized. And on the top is people after they've received first dose. We can see that it does take, there is a drop-off after 14 days and then an additional drop-off after about 3 weeks, day 21. So this is when your body is developing the immune protection that you need to protect you long-term. We can see, though, that it rapidly tapers off after that, and after several weeks, we have very low rates of infection. The bottom is case counts, because we've had such low numbers of people after 7 days after receiving their second dose of vaccine. We see that there's just sporadic cases, and again, those drop off after time. I will say that this reflects primarily the Pfizer vaccine, because that has been the majority of people who've received vaccination has been with Pfizer. So 1,110 of the cases received Pfizer, 127 Moderna vaccine, and 103 AstraZeneca or the Covishield vaccine. We have some great similar data that comes from the First Nations Health Authority, who, as we know, have been following the COVID outbreaks and vaccination in First Nations communities, and this reflects very similar to what we've seen overall. This uses 14 days post first dose. So again, we see a dramatic drop-off after 2 weeks, and again a second drop-off after between weeks 3 and 4. And these were 353 cases in First Nations communities. You'll remember that First Nations communities were prioritized for a variety of reasons to receive immunization, and for most of the communities, we've done it in what we call a whole of community approach. And this is a nice representation as well of the reduced risk of infection after a single dose of vaccine. So this is important. It is the number of total cases per 10,000 people. And with the orange lines show you the rate prior to immunization. And then the blue lines are post a single dose of either AstraZeneca or Pfizer or Moderna vaccine. So again, really positive, showing us the risk decreases dramatically, but it is not zero, and it takes some time to get to that level of protection. Some of the other data that we've been following is looking at some of the communities where we saw very high case rates, and we went in and immunized the community as a whole. And this is the information from Prince Rupert, and when the gray bar shows the time period where the immunization clinics were happening, and then the drop off over time. And the important thing here is, even though cases were increasing in the community at the end of March and through April into May, outside of Prince Rupert, we saw a sustained and low level in Prince Rupert itself. So this is something that helps us understand what may happen as an entire province once we get to those levels of immunization. The fact that we can see rapid drop-off and sustained drop-off over time when we have that community immunity, even in an area like Prince Rupert. The other places where we've seen this similar phenomenon has been following the data of long-term care, where healthcare workers working in long-term care who were prioritized to receive vaccine first. We had a dramatic drop-off over time, and that was sustained even through this third wave, where we see the blue line on the top is healthcare workers in settings other than long-term care, where we did see higher levels and a bump up during the third wave. And we see the same thing as well for residents. So residents in long-term care homes, 70 and above, on the bottom line, once we reach that point where 90% of residents in long-term care or assisted living had been immunized, we see a rapid and sustained drop-off of transmission. And we look at these as small microcosms or communities within themselves, where we've reached that point of community or herd immunity within that care home. And despite the dramatic increase that we've seen over the last few months in cases in the community, in the same people aged 70 or over, we see this sustained decrease in protection in our long-term care homes. And if we look at it again, this is taking just that portion of 70 and above, and on the bottom you can see the immunizations in that age group have gone up. On the top it shows hospitalizations, and it tells us again that once we protect people with immunization, gradually we see a decline in hospitalizations, and now we're starting to see the effects in those age 40 to 60. So data I've presented in April showed that it was the 40 to 59-year-old age group that was increasing in our hospitalizations and having more severe infections. Now that immunizations have increased in that age group, we're starting to see that level off as well. So what does this tell us? This tells us that we're seeing really strong progress through our immunization program across the province, and it's making a difference at a health authority or at a healthcare facility level, at a community level, at a population level. But we need to keep it up. And there have definitely been infections. We know that this vaccine, even after 2 doses, all of the vaccines we have are not 100% effective, but they do absolutely reduce your risk of infection, and importantly, they reduce your risk of transmitting to others, and they reduce your risk of being in hospital, of needing ICU care, or of dying. So these are important things for all of us. One thing I will say is we've started our program based on risk, and that's your own personal risk of having severe illness or death. That's why we started with long-term care homes, why we started with our elderly and seniors first. So we expect to see, when more and more people in our community are across the board are immunized and protected and case rates start to fall, that we will see a rapid drop-off in transmission across the province. So just a final note, we are doing what we call vaccine effectiveness studies, so the detailed studies comparing individuals who are immunized and non-immunized, and the team at the BC CDC, led by Dr. Skavronsky, is pulling that data together. We've now past that period of time for older seniors where we can understand the impact at a community level, and we're working down the age groups as 3 weeks have passed since we reached the threshold in people aged 60 to 70, for example. So more of that information will become available to us in the next few weeks, and we will share it when it's available. And these slides will be posted on the BC CDC website, so you can go back and look at them at will. So what does this tell us? It tells us that our risk-based approach to the immunization program that we've had here in BC is working, and it shows us a glimpse of where we as a province will end up in the coming weeks and months. We've seen very big benefits from our immunizations in the highest risk people in our communities, and the effectiveness of vaccination in a whole of community approach. It's a good indicator of where we will be in our province-wide approach. Receiving the first dose of vaccine substantially reduces infection rates and reduces your own personal risk. However, one dose doesn't give you or those around you complete protection, especially when, as we continue to have high rates of circulation of the virus in our communities. That's why a second dose for everyone is also incredibly important. So the one dose shows COVID-19, and a second dose pushes it back. Even though lots of people are now vaccinated, there's still a lot of virus circulating. We won't get to the bottom of our infection curve until we get to a much higher immunization rate. So everyone needs right now to register to get vaccinated, and we know that it will be all adults very soon will be your turn. It's also, though, why it is incredibly important for us to continue to take those measures that break the chains of transmission in our families, in our communities, in our workplaces. Immunizations are going up, and community transmission is trending down. And those are the things that we need to continue. What we are doing in BC is working. As more and more of our loved ones in our communities and our families are being protected, and we're taking those measures to reduce the transmission. So let's keep that curve bending down. We look to brighter days ahead, but right now we need to hold the line. We need to keep doing what we're doing as we get more and more people protected. So we will not be seeing any changes to the measures that we have in place right now until after the May long weekend, and even then, it's not going to be flicking the switch. It's going to be gradually and slowly increasing the light. And that is important for all of us. We can see a future where we don't have to have COVID-19 ruling our lives, when we can get back to doing the things that we know are so important for us as individuals, as families, and communities. So let's keep this momentum going, and remember to continue to be kind, to be calm, and to be safe. Thank you.
Thank you, Dr. Henry. I wanted to start on behalf of the Premier of the government, I think of everyone in BC, to pass on my condolences to those who lost their lives in the last 24 hours, and indeed throughout the pandemic. 1,632 people since the beginning of the pandemic have lost their lives linked to COVID-19, to families, to caregivers, to communities, to friends. These are enormous losses, and we continue because we are limited in the ways we can come together to grieve, limited in that way. And so we all need to, all of us as communities, grieve together and support those families who've lost loved ones in the course of this pandemic. I wanted to note that we did 8,195 immunizations yesterday, which is a significant achievement for all of our immunization teams and all the different health professionals and healthcare workers and people who are supporting our immunization efforts across BC. These are remarkable achievements that everyone involved in them, from doctors to nurses to pharmacists to all those who are working to support to firefighters to other emergency first responders to ambulance paramedics to all those who are involved in our effort. We say a big thank you for yesterday and for all of the other days. I'd note that in terms of vaccination by age groups, these are a day old, but over 86% have received their first dose. Over 60, obviously that includes the people over 70, 81%. Over 50, that's 74%, and over 40 is 66% of people. And so we are making progress, and we have a significant way to go. Part of the thing that we all need to do, and the three words for today are register, register, register. 2,596,062 people have now registered since April 6th on our Get Vaccinated website, or by calling into our number. So that's a significant number. And yesterday, the top groups, age groups by registration, were 18 to 24, 30 to 34, 25 to 29, 35 to 39, and 40 to 44. And that is good. Everyone needs to know we opened up yesterday and sent invitations to book to all those over 30, people born in 1991 or earlier. It's over 18 or born in 2003 or earlier if you were in a hotspot. Indigenous people born 2003 or earlier will be invited to book almost as soon as they register. Clinically extremely vulnerable people as well, and pregnant people born in 2005 or earlier. And just as Dr. Henry has said, and this information has gone out from Immunization BC, on May 14th, which is tomorrow, those born in 1996 or earlier who are 25 and above will be invited to register. That's after 7 o'clock and overnight. Those invitations will go out. So if you're in that category, it's a significant category, then you will be eligible then. On Saturday evening, after 7 o'clock, those born in 2001 or earlier, 20 plus, will be invited to book. And the key to booking is to have registered. And on May 16th, Sunday, those born in 2003 or earlier, all across the province, 18 and above, will be invited to book their appointments. The key is to register. So if you know anyone, especially those between 18 and 30 who haven't registered yet or thought the age-based immunizations was a sufficient way away from them, now is the time to register. Register. It is a big, I think, a big move in terms of the age cohorts. Is going to happen over the coming weekend, and so now is the time. And if there's any doubt about the value of immunization, I think Dr. Henry has taken you through that today. It is transformative, of course, to people and their safety from COVID-19. I want to report briefly on our surgical renewal commitment. You will know that until the COVID pressure on our hospitals is reduced, we are reducing in select hospitals in the Metro Vancouver area, in the Fraser Health and Vancouver Coastal Health Authority. We are postponing non-urgent elective surgeries. To date, the number of surgeries postponed from May 3rd to May 9th was 664. That's 305 in Fraser Health, 314 in Vancouver Coastal Health, and for other reasons, 45 in Vancouver Island Health. Once again, it remains the case that in Interior Health, Northern Health, and the Provincial Health Services Authority, no surgeries were postponed. So in total, from April 19th to May 9th, a total of 1,483 surgeries have now been postponed. In the week April 26th to May 2nd, and health authorities completed 6,664 surgeries, of which 5,274 were scheduled and 1,390 were unscheduled. These numbers reflect, and it shows the enormous work still being done for people across health authorities, but they reflect what we expected to see. It doesn't lessen the disappointment the postponements caused our patients, their families, and their care providers. Again, each of those patients will be contacted to rebook their surgery once the pressure on our hospital decreases. I note in that regard that in terms of base beds, we have about 638 vacant base beds across our system and 3,076 vacant surge and base beds, and in ICU, 76 vacant base beds and 273 vacant base and surge ICU beds or critical care beds. However, we are using surge beds in the Fraser Health Authority and the Vancouver Coastal Health Authority, currently 175 surge beds and 21 critical care beds are being used. And what that says to us is that COVID-19 is still circulating too much in our community. Hospitalizations have come down from the peak in April by about 98, so we're at 413 today in hospitalizations, but that is still way too high. 141 in critical care, still way too high. And the greatest gesture each of us can make in respect of those awaiting surgery, for example, is to get vaccinated. If we have not registered, again, we must register now. And when we're invited to book our shot, we must book right away. We can go to the Get Vaccinated website again, or alternatively, 1-833-838-2323. That's 1-833-838-2323 to take that vital step in making ourselves and our communities safe. Right now, 51.5% of those eligible have had their first shot, and 2.8% have received their second dose. And while many of the key indicators show that the COVID-19 pandemic is moving in the right direction, let's face it, 500 to 600 cases a day is still way too high. We need to continue to use our COVID skills, register, and get our vaccinations, and remembering all those who count on us to stop the spread. It will make all of the difference. And that difference will be shown in the days and the weeks to come.